Hello, everybody. Today is September 28, 2021. I took care of my patient this morning at clinical. My patient is a 51-year-old Caucasian female. She came to the office today for a crisis meeting. She was scheduled to come next week, but she was having increased anxiety, so she called the office to be seen early. Okay, my patient, little background on her. She was raised by her grandmother because both of her parents could not take care of her. She said she had a happy childhood. She had two other sisters who were adopted outside of the family that she does not know. She's currently in the process of looking for them. Patient stressor for today. She having issue of grieving. She lost her husband January this year to COVID. This was her first marriage. It was her husband's second marriage. He was previously married for 20 years and had 4 children. So her stressors now is that she finished the probate for her husband's will, and her stepchildren are not happy with her. They are not speaking to her, so it's causing her a lot of stress. Okay, so we'll go to the mental status exam. My patient appearance is appropriate. She dressed appropriate for the weather. She is well groomed. She described her mood as so-so. She said she get anxious or depressed sometime, but she's doing okay after all. Her affect is bright upon arrival. She denied depression, mania. She reported some anxiety with racing thoughts when she misses her husband or when she's talking to her stepchildren. She said she denied hallucination, delusion. She got good insight on her appointment today. She denied suicidal thought or any intention to hurt herself. She reports an okay sleep. She said she had been sleeping between 5 to 7 hours. She said she had been trying to eat plenty vegetables and fruit. And she said for exercise, she keep herself busy working in the yard and going to work and meeting with her friends. Okay, that's a mental status exam. Now we'll go to the DMS-5 ISIS. ISIS-1 patient has diagnosed with major depressive disorder. ISIS-2, I would defer that. ISIS-3 medical, she has hypertension, hyperlipidemia. ISIS-4, the psychosocial environmental factor. She's doing good. She's working a full-time job. She in a grief support group. She meet with some friends once a week to walk together. She says she have good support system. ISIS-5, the global assessment functioning, I'll give her 88. She's doing pretty good. For differential diagnosis, my differential diagnosis for will be generalized anxiety and PTSD. Generalized anxiety because of now she live alone, and major depressive disorder is almost going hand in hand with anxiety. Okay, for medication, patient has been on Buspar 15 milligram TID, Prozac 40 milligram daily, hydralazine 10 milligram TID PRN, and Lamentil 100 milligram daily. What the plan for this patient? We are going to continue all the medications because she said they are working. And then we are going, we check her vitamin D, it was 13. So we're going to start on vitamin D 5,000 units daily. Okay, that's all for my references. For my medication, I use the store prescriber guide 2021, and also for my DSM-5, I use the American Psychiatric Diagnostic and Statistical Mental Disorder, DMS-5, 5th edition, 2013. Thank you.